Hey Mizo, it's Bethany. I thought it would be easier if I just did a quick little video for you so I can show you where I'm at with my sample client, Susie sample client, instead of trying to just do screenshots or something. So just to run through it super fast, and I'm certainly not the expert here, but obviously when you first go into therapy notes, you can add in the patient information. This I did as a couple, but I did it like she was also presenting with a different diagnostic situation, in this case, depression, so that it would be something that would potentially be covered by insurance. I kind of picked the most complicated one. If I were you, I would just do an individual client, something like generalized anxiety disorder, and be done with it. But I wanted to practice all of this stuff because I wasn't sure. So apparently, if there's a code that you're going to put through to insurance, under patient information, it needs to be just a single name. So like right here, it says Suzanne and then middle initial C, which indicates couple, and then their last name. And then adding the husband in as a contact. If this were just straight up couple therapy with no depression and no insurance implications, you would put her first and last name in the first field, his first and last name in the last name field, and then the letter C in parentheses in the middle name to designate a couple. So hopefully that makes sense. The only other thing on this page that I thought was of note is she does want in the patient comments here, what's the unit of treatment, and then the sliding scale or whatever negotiated fee that you arrived at. If you send the thing through the portal, I don't know what it's called, client information document, I guess. Let me see. I think that's what it is. Client information form, this one right down here. If you send that through the portal to them, it'll auto-populate all of the fields in the patient info. So it'll come back to you when they submit it online and say, this is your old data, this is your new data. Do you want to accept all of their changes? So if you just had the client's name in here, I think then if you send that through the portal, it'll auto-populate with everything else they fill in. Or you can just ask them in the session. Or it looks like poking around, it looks like some people don't always have everything filled out, and that seems to not be really a problem. I think the most important things is that you have, name, date of birth, address, phone numbers, probably email address also. Okay, so that's that. Then when I did the intake note, so I created an intake appointment for her, and then at the end of that, it prompted me to create an intake note. And so I'm going to put this back into edit mode so you can see what it looked like when I was actually filling it out. I just noted here that this was a fictitious client because I didn't want to confuse myself later, even though I made her last name sample client. So here is just the overview of why they're coming into treatment at all. And I know Alyssa said that she was advised that if you're actually quoting them, put it in quotes so you understand that those were their words that they used. Under this mental status, if you click this all normal button, it will auto-populate everything coming in as normal here. That seems like probably a best practice. And if you felt like, oh gosh, everything was normal except for her speech wasn't normal, let's say, then you could go in and you could change that to something else if you wanted to just change one of them. But that's a little time saver versus going through and having to mark everyone individually. Under the risk assessment, this is where I put that she didn't have a risk because she was saying she didn't have suicidal ideations. But if you had someone who was, you would click on this down arrow here and just choose what the problem is. Objective content, this is where I just cut and paste into kind of like, here's everything that I went over with them. I'm a trainee, gave them the informed consent, talked about mandated reporter status, reviewed practice policies, cancellation fees, how to contact me, what the hours are, what our fee agreement is, how we do the billing. I also added in here, this was a question I'd asked in supervision about, should we let them know at the front end that when I graduate, it will be more expensive? And it sounded like that was probably a good idea. So just to say, hey, at some point, this fee will change when I become an associate MFT. Risks and benefits of therapy, reasons that either she might terminate or I might terminate, and how referrals might fit into the whole thing. This biopsychosocial assessment also populated from the thing that I had sent through the portal. So if the person doesn't do that, my understanding is just that during the intake session, you would ask these questions. And then this area tripped me up a little bit. When it said plan, I was like, well, I'm going to do a separate treatment plan. So I just noted that. That seemed fine with Carissa. But under this one, I did just say that kind of as a side plan, I was asking her to see her PCP just because she noted that she was on thyroid medication and suffering from depression. And sometimes there can be a connection. Just to have it checked out. Sounded like she hadn't had a checkup for a while. So just wanted to, double check on that. And then under diagnosis, because it's a couple, you have to have that Z code. Since I complicated it and made this MDD diagnosis also, that goes first because that would be what would be billable for insurance. And then the Z code comes second. But if this were just a straight sliding scale, cash pay situation and you're not billing insurance and there wasn't the depression, you would just use the Z code here. And then when you sign it, then it goes to Carissa. Okay, so that's intake. And then the next one is the treatment plan. This is the one I thought was the hardest, or at least the most confusing. So there's those two other documents, therapy notes, instructions, which is in the library on therapy notes, which takes you through step by step, but again, and the intake as well. I thought it was just a little bit confusing on some of the things, particularly under this section of treatment goals. But that you'll use for the treatment goals, and then also this theory with concept cheat sheet. This is where she's saying you can just literally copy and paste it into the objectives. So I'll show you, I went back and cleaned mine up because if you caught during our supervision session, I had some things that I think were just a little bit more complicated than they needed to be. Again, going back into edit status here so you can see it like you were actually filling it out. So reiterate the diagnosis. I think this populated in actually, or maybe I hit this little history button over here, but I think when I pulled this up, it was there. The presenting problem, either I copied and pasted that, or again, it may have pulled in from the intake because that should just be the same. But then this was the meat and potatoes where I got a little bit messed up. So what is the section called? Treatment goals. So this is where in the instructions it has the 8 different things that she wanted, and I didn't have all 8 in. So I would recommend literally putting 1 through 8 as the categories. And again, I think that's something you could have in a Word doc and copy and paste each time and then go through and fill it out. So I thought client goals, collaborative goals, and therapist goals were a little bit overlapping. You heard that conversation, so you can kind of see how I tried to fit it in here. Symptomology to alleviate, I just noted the depression and then the relationship issues they were having as a couple. And then if progress towards goal isn't met, I just kind of came up with a little plan here. And again, I think this could probably be pretty boilerplate too. These seem like generic types of things you might do with most clients, but I'm not sure. And then again, because I had 2 separate things, both her depression and the relationship piece, this is more complicated than it would be if you just had a single client with kind of a single presenting problem. So I chose 2 theories, one to address the depression, CBT, and then one to address the relationship distress, experiential. And then I copied over from the cheat sheet. So, well, you already saw that, but from the cheat sheet, the 4 objectives from CBT, and then linked it back to how it would help Susie. Originally, I had done that in this section down here where the objectives are, and that is not where she was expecting to see it. She's expecting to see it here. So I would recommend just doing it here and keeping the part below super clean, because that's the part where she's just saying, it's easy. Just copy and paste the concepts that I already created for you in that cheat sheet. And then the last thing on here that I kind of messed up on was the legal and ethical issues. I thought because on my intake thing, I had done the safety assessment and said that she was not a suicide risk, that was sufficient. But she wants under here these kinds of things addressed, like the telehealth. I said this couple would not be ideal telehealth because couples in general, it sounds like she doesn't want them to be doing telehealth, or severely depressed people, because if the call drops and you're not able to observe body language, it's just complications. There's mention also in this section in the instructions that the COVID consent form was received from them. And then here is where, because she falls into one of those categories like bipolar, major depressive disorder, PTSD, there's a list in the instructions. I think it's 6 different diagnoses, that if they have one of those as their diagnosis, you need to say that you discussed a safety plan and understand if there's risk or not risk. So her risk I'm noting as low, that she has protective factors like a family who doesn't want to ever harm herself because she loves her kids so much, and no intent, plan, or means to harm. So I think this, again, you could probably have some language that you cut and paste with some regularity, but just tailor it to the specific conversation you have with the person and specifically what protective factors are in place there. This category would also have the things like ROIs, court orders, anything like that that's sort of more in that legal space. Okay, again, because I did two different theories, one CBT and one experiential, I have a whole mess of objectives here. So there's a total of 8, but this is where she's saying just plug it and play it. So put the concept in here as the objective. And then this treatment strategy is just a down arrow where you can choose from the various strategies. And if you just click on it, it drops it right in. Oops. Now it's in there twice because I already had that in there, so I'll delete that. So you can do that for each of the concepts, but the concepts just become the objectives. I found that part of the instructions a little bit confusing, but it's just copy paste on this from that cheat sheet that's available in the library. And then that's it. Just really saying how long you think all of this is going to take for each of the objectives. I just kept it consistent to say overall treatment would be 3 months. I didn't differentiate by objective. I'm sure you could. And then I recommended a weekly frequency, and then I would sign it, and then it goes to Carissa. The final thing in here was just the progress note, which was easier. And that pulled in all of those objectives, and I was able to say that where there was progress or no progress or progressing, and able to say kind of what was going on. So Susie's using the journal. She reports having 2 great days and 3 depressed days during the week. This is an improvement. So that was just kind of how I responded to those. And then the plan, I just said reconvene in a week, which was the prescribed frequency anyway, and that's it. I hope this is helpful. Again, I'm totally not the expert. If there's any questions you have, flip me a text, but I thought this might just be easier than trying to send you a bunch of screenshots. And I just think it would be so helpful the first time you're doing it to look at something just so you know kind of where you're headed. At least you can kind of learn from some of the mistakes I made. I hope it goes well for you, and good luck with your real ones you have to do too. Take care. Bye.